This video is part of our Virtual Technology Showcase series. In this video, we will see examples of different types of telehealth programs and technologies for school-based telehealth, followed by a question and answer session with school-based telehealth experts. Enjoy the video.
Good afternoon. I'm Nikki Parashow, Program Director for the NRTRC. We would like to thank you for joining us for this session, Keys to Creating a Successful School-Based Telehealth Program. This session was created in collaboration with my colleagues from SETRC and TEXLA, and will demonstrate how to leverage telemedicine in the delivery of healthcare within school systems, along with discussing the types of technologies used for school-based telehealth. Featured will be examples of students connecting with mental health, acute, and primary care providers, and we will learn about the benefits of using technology to connect students to school nurses that are off campus. So without further ado, I'd like to introduce the first video from the NRTRC and their parent organization, the University of Utah and the Utah Education and Telehealth Network, UETN. UETN has a unique purpose of connecting people and technologies to improve education and healthcare in Utah. In line with this purpose, UETN seeks to bridge the gap between education and healthcare by providing local nurses throughout the state with telehealth technology to perform virtual visits and assess health of students remotely. UETN is working with numerous partners throughout the state, some whom you will hear from in the upcoming video, to develop a program that will serve the immediate needs of students and nurses and to incorporate local healthcare providers offering both medical and mental health services to students. The three primary goals of UETN have been: 1, to place telehealth kits in schools that need them the most, beginning with Title I schools in large rural school districts; 2, reduce the windshield time of school nurses traveling from school to school in their district; and 3, to improve access to care and overall health of students in Utah. So please enjoy the video.
The most critical healthcare needs of students in Utah are case management of any type of chronic health condition, that being asthma, diabetes, ADHD, our mental health concerns, and then of course we also have a high need for treatment of acute care needs, which are strep, ear infections, cellulitis, and dental cavities.
Their basic preventive care is really important. We saw a dip during COVID. Kids were not getting in to see their pediatrician. They weren't getting their immunizations. They were losing ground on a lot of the preventive care that's been done over the years. And so that's another important piece of this too, is making sure that kids are getting back on track and getting covered, getting seen.
Anytime we can keep our students in school, not only we are increasing their attendance, but we're keeping them healthy, we're educating them, they're more likely to graduate. School nurses are really the first line of healthcare for most of our students in Utah, especially in our Title I schools.
The most critical needs for school nurses is that there's more of us. School nurses have heavily been impacted by COVID, especially over the last couple of years, but before that we were overworked. You know, it's going to take more than one school nurse to serve 25,000 students. And so we need help, we need assistance, and we need funding.
I think telehealth would assist school nurses in giving us an opportunity to care for students without having to travel. I would like to see every school have access to telehealth, and that way we could address every student, and I want to include staff. We have a lot of staff with health concerns as well, and mental health concerns, and so we would want to be able to utilize telehealth to help them with any of those types of concerns. Again, connecting to primary care practitioners in order to be able to take care of these concerns in real time.
A lot of our schools also, even in counties, are spread far apart in Utah, and so anytime a school nurse needs to access their students, they have to drive in between schools, and so that's what it does, is it gives us time and it gives us access to our students.
It's not like telehealth is just the answer. It's just that incredibly important tool. It's that vehicle to help meet these other needs met. Telehealth can help in rural areas. It can help in underserved areas. It can help kids feel comfortable in the environment where they're at to be seen. Telehealth does not replace school nurses. We need school nurses. We need school nurses in all of our schools, and we need telehealth. Telehealth is an incredibly valuable tool for our school nurses to use in order to be able to do their job even better. So school nurses are incredibly important, and telehealth is an incredibly important tool for them.
I see it as a tool that nurses are going to be able to use to do more with less.
This is our telehealth kit. You can see the tablet with keyboard, documentation, and all of the Bluetooth-enabled assessment devices. This is a finger pulse oximeter. All of the devices that we have that connect to the tablet are either Bluetooth or connected via USB-C cable. This is a Bluetooth touchless thermometer. This is a blood pressure cuff. Just attach it to the student's arm and hit start. This is a Bluetooth-enabled stethoscope. Just place it where you want it, hit record, and then you can either play the audio back, or if you have the tablet connected via a Zoom call, the person on the Zoom call can hear the audio live.
Well, thank you very much for the opportunity to be with you here today. My name is Boyd Mark. I'm a program advisor at the Southeastern Telehealth Resource Center. The Southeastern Telehealth Resource Center, also known as CTREC, is responsible for the states of Alabama, Georgia, Florida, Puerto Rico, South Carolina, and the territory of the U.S. Virgin Islands. I became a program advisor with CTREC last year. However, for 5 years prior to that, I was the director of a national telehealth program at the Scott Center for Autism Treatment, a nonprofit treatment, training, and research facility on the campus of the Florida Institute of Technology. And during that time, the Southeastern Telehealth Resource Center was instrumental in helping us put our program together from a technology perspective, a reimbursement perspective, a lot of guidance, and connecting us with the right folks. So I would like to say to everyone out there today, if you are looking for assistance with your telehealth program, the telehealth resource centers are a great resource to use. I personally can tell you they made a huge difference in the progress of our program. Now I'm super excited to be with the Southeastern Telehealth Resource Center and to be able to help others grow their program. And thank you to the NTRC and TTAC for allowing me to be here in this session today on school-based telehealth. What you're going to see here today in the video coming up is an actual school-based telehealth encounter. This is not a simulation. It's not a staged encounter. It's an actual encounter that took place when we were there at the school. This is actually the child of a person in the CTREC team, so we had full disclosure and full consent to present this information, as well as consent from the school. You're going to see a second grader in an actual encounter presenting an earache, going to see the nurse, and you'll see the nurse doing the initial assessment, then getting consent from the parent on the phone to conduct a telehealth encounter. You'll then see the school nurse scheduling that encounter and then acting as the facilitator at the originating site while they interact with the healthcare provider at the distance site who's assessing the child. I want to tell you, you're going to see some actual video from inside looking at this child's ear, and it's a little bit graphic, it's a little real, it's a little gritty. But this is really how telehealth encounters in school-based environments work, and I hope you enjoy it.
Hi, Jerry. Hi. What you got going on this morning?
My throat's hurt and it's just really stuffy. And
Sounds like you got a cough.
whenever I just blow my nose, it kind of comes out my ears.
When you say come out your ears, I mean it hurts?
Yeah. And it's kind of like a strong air comes out.
Okay. Well, I think we might need to call your mama and see about maybe doing a telemedicine appointment with Miss Lori and see what's going on with you. Will we check your temp? I'll do that every time. Hey, Miss Sermons, this is Jana, the nurse at Williams Heights. I was calling about Journey. She's not feeling well. She came into me just now. She's complaining of a cough, a sore throat, and her ears kind of bothering her a little bit when she coughs. I wanted to see if you would like me to call Miss Lori Henderson and see about making a telemedicine appointment for her this afternoon or this morning. Okay, that sounds great. I'll call you back and let you know after the visit and let you know what she said, okay? Thank you. Bye-bye. Hey, this is Jana, the nurse over at Williams Heights Elementary. I was calling about a patient of y'all's and a student of ours, Journey Zakowski. Yes, ma'am. She's complaining of some issues that I wanted to see if Miss Lori might could see her. She's got a sore throat, cough, ears kind of bothering her a little bit. Yes, ma'am. Yes, ma'am. Okay, we'll see you at 11:30 then. Thank you so much. Bye-bye. Now you sit down, Journey, if you want to. She is coughing. She got a sore throat. It's pretty red. And anything else, Journey, that you said?
Well,
Tell her?
whenever I blow my nose, it's kind of like my ears hurt.
Your ears hurt when you blow your nose? Okay. I did look in her ears, and there's one ear that I want you to look at, though.
Okay.
Okay. And it's not red, it's just something else. I just wanted you to see what you thought.
Okay.
Okay. Stand up for me, baby. Can you see us?
Yes.
Not that one.
No, that one's got a little piece of wax right there in the front. You can't see really good in there. But this is the other ear that I wanted you to see.
Journey, have you put anything in your ear?
No.
Okay, that looks like fungus, Jana.
That's what I was afraid of.
Yeah, so we need to call her in some fungal ear drops. What about her throat, Jana? Does it look bad?
It's red. Turn this way. Yeah.
It is red. Okay, well, let's do some, maybe some warm saltwater gargles for her throat, and then let's get that ear fixed. Do you have her vital signs, Jana?
I'll send them to you.
Okay. And that's her left ear?
That's her left ear.
Okay.
Okay, well, I think we can go ahead and get started with a few questions. But first, I'm going to have Matt McCullough introduce himself as well, since you didn't see him in any of the videos. So, Matt, over to you.
Okay, thanks, Jolene. Hi, everybody. I'm Matt McCullough. I'm the Director of Telehealth Services for the Utah Education and Telehealth Network and the Principal Investigator for the NRTRC. So I'm happy to be able to join you all today and talk about school-based telehealth.
Great. Thank you so much. The next question is one for all of you. What quality measures are being tracked for school-based telehealth? I'm going to give it to Jennifer to start first.
I will jump in. Okay, so what we do is we have a vast array of mental health assessments that we have them complete when a school counselor refers a child into our program. So a child can be referred into our program in many different ways. It may be the parent talks to the counselor identifies the child, or their pediatrician identifies that child and then connects them back to the school counselor for services, because we have a separate program where we work with pediatric primary care providers. So that being said, with that, we have a vast array of assessments that all students, regardless of what the reason for referral is, that they will complete, and then we recheck and re-deliver those assessments towards the discharge of them exiting our program, so we can see what that status is of how they are scoring on each of these assessments. For our sake, the program that we operate is not intended as a long-term treatment option. We are designed to essentially get children stabilized and to refer back into the community to get them established. Now, as was said in the video, it's difficult when there are a very limited number of community resources to connect back to. But for us, it's trying to get them stabilized. So for us, that's a way of checking that quality. Are they at a stable place by the time they exit and we connect them back into the community?
Could I also add something to that?
Absolutely. I was going to call on you next.
Oh, thank you. Well, our program is designed to provide support to schools that would like to implement a telehealth program. Lauren Nix, who is actually the director of our school program, compiles statistics across all of our area on the number of visits, the type of visits, frequency of visits, acuity, mental health, behavioral health visits. So we're compiling that information, which we would be happy to share. Quality of visits per se is not something that we're tracking. We rely more on the schools and the providers to ensure they're following those quality standards. Our role is to understand how the dissemination of telehealth in the school systems is progressing. And just, interestingly, we've seen a lot of kind of unusual metrics after several years of really steady growth. The number of school-based telehealth visits have declined, but that's in direct correlation to the schools being closed during the pandemic, and as well as many students, if they show the slightest signs of any kind of respiratory or cold symptoms, they're not even being allowed to stay in school, right? So what we've seen is interestingly, the number of mental and behavioral telehealth visits in the schools staying steady and increasing. So clearly the students are still in the school. They need that support. But otherwise, we're seeing some of them go down just in correlation to the fact that the students haven't been in school as much.
Okay, and finally over to Matt and Nikki.
Yeah, I'll just jump in real quick. So the main quality measures that we're tracking right now are primarily just the number of telehealth visits that are being done between students and school nurses, and the number and type of measurements that are being taken. So when we look at the otoscope, the stethoscope, the pulse oximeter, the blood pressure cuff, how many measurements, and also another one we're really interested in is the percentage of students who are able to stay in school and return back to class after doing a telehealth visit with their provider. We have a number, I think it's 93% of students who in person are able to visit with their school nurse, are able to return back to the classroom. We want to see if that quality measure stays the same for telehealth visits.
Okay, great. Thank you so much. Next couple of questions pertain to the devices and the peripherals being used. The first one is I'm interested in the digital otoscopes that are being used. I have a WhiskMed digital otoscope, but like the size of the screen in the first video. And then the other one is what is the cost of a digital otoscope and stethoscopes setup? Is there an annual fee?
I would be happy to find out which otoscope that was and get that information to you.
Yeah, I'll jump into that. In the telehealth, the school-based telehealth kit that we're using, we have both the otoscope and stethoscope. They were purchased as part of an entire kit, along with the blood pressure cuff and pulse oximeter and the tablet with a number of years of maintenance and support. So I can't give the exact price just for those pieces because it came as an entire kit with support and software and everything. But we really like the otoscope that we're using. Plugs in via USB-C, and it's very small. It's kind of like the size of a small pencil with the cap on the top that's very easy, very small, and mobile friendly.
Great. The next one is kind of a question / comment, but I'm going to ask you guys if you've heard anything about any research being done on this. But this person is saying it would be interesting to see cost avoidance to parent, what they would have done if they had not had this access, like visiting the emergency department or an offsite clinic. Any comments or any research that you know of being done on that?
I will say for ours, which is a little different with the mental health component, but still will have emergency department visits at times for students. With us, it's just they don't receive the care. They just do not receive the mental health care that they need, in part because there tends to be a 6 to 12 month wait time to get in with a child and adolescent psychiatrist. And then because our region is so vastly spread out with child and adolescent psychiatrists only covering 8 counties across an 87 county range, so that can mean that families would be driving 3 hours one way to get somewhere. So in those cases, many times they don't receive the care.
Matt or Boyd, anything to add?
I think I don't have anything quantitative to add to that. That's a great question. I would concur that a lot of the students simply aren't going to get a visit at all if they don't have access to those services at school. And I mean, you could extrapolate some data and look at the number of visits that occurred in any kind of catchment area and think about the percentage that might have occurred. But we don't have any solid data on that. I do want to I texted somebody on our team, and that's the Horus scope, HORUS otoscope that you saw in the video.
We've talked quite a bit about the cost avoidance. I mean, you look at a lot of the pieces of that equation that would be, you know, the time, let's say the parent has to leave work. They have to drive to the school, pick up the student. Maybe they then have to drive and take them to a provider, you know, a primary care provider for an appointment. So we haven't tried to calculate that, but there's obviously a lot of pieces to that equation that would add up and save quite a bit of money. One thing we've tried to do with our school-based telehealth kit is within the software, when they start the telehealth visit, we've added an invite button, and basically it sends a text message or an email to whoever the school nurse wants to invite to that telehealth visit. So that might be the parent or another caregiver. There was a question in there about coordinating with dental offices, and so we've tried to make it really easy for the nurse to be able to send a quick text message to whoever they would like to invite in to join that meeting and be able to collaborate on the care of that student. And I think all of that adds to that conversation of cost avoidance or savings.
Great.
Yeah,
And I'm going to do one more question, and then we'll kind of wrap things up. I know that Dr. Rojas actually kind of already touched on this, but I think it would be interesting to know what everyone else is kind of thinking in terms of funding. What funding and or resources are available for school-based telehealth, and how can people go about finding those and applying for those?
well, I would say, at least in the Southeastern Telehealth Resource Center area, we have working groups by state where we meet on a regular basis and review, and the public is invited, and we have regular attendees from schools, from academia, from healthcare, and things like legislative updates and funding updates are something that we specifically provide. So I would encourage people to reach out to their telehealth resource centers who would be able to help them out in that regard, for starters.
And I did want to give credit with that legislative funding that came. We had the Texas Child Mental Health Care Consortium created during that legislative session, and that is our overarching governing body, if you will, for the funding that went across the state for us. I did want to add in, if you're thinking of teletherapy or telemedicine in the sense of mental health care, we have a technology set up, just Jaylene, to add to that question that came up, and that is approximately, it comes under just under $2,500, so it's about $2,445. And we have an iPad with that kit, a portable scale, a studiometer for the height measurement, and a blood pressure machine with multiple cuff sizes, because we do work from elementary to high school age students. So that's about the cost for the types of technology setups that we're using.
I would also just encourage people to contact the Center for Connected Health Policy. They do a great job of being able to direct people toward grant resources and funding.
And I'll maybe just touch on a few more. The telehealth kits, the school-based telehealth kits that we purchased, were purchased with CARES Act funding. There's other opportunities right now through individual states with the ARPA funds, the American Rescue Plan Act, and also potentially with this new infrastructure bill, opportunities to start programs like this. Obviously, an appropriation from a state legislature with ongoing funding is going to be ideal. So bringing the right partners together to approach the right people for that. But in terms of just the equipment as well, there's other federal funding sources. The USDA Distance Learning and Telemedicine Grant is specifically designed for the purchase of equipment, and there's others as well. But there's always the difference between the personnel and the program support and the equipment itself. Is just something to be aware of.
Yeah,
Awesome.
every state that we cover has grant funding now available for, especially for telehealth, mental health, behavioral health, and as well as medical treatment. So now is a very good time for schools to pursue something